We want you to have an idea of what you'll face when you go to your first chemo treatment, so we've called in our expert oncology nurse.
Before you come for your chemo day, eat and drink what you normally do, take your normal medications, and eat and drink what you normally would during the day. When you come for your chemotherapy, we will go over your medications. We will not give anything to you before telling you exactly what it is and the side effects. We will tell you how to care for yourself before and after chemotherapy. So I want to show you washing of hands. This is the main way to prevent infection during your chemotherapy. Washing your own hands is very important to prevent any germs. So once I have washed my hands, I know this is your first time, so we're going to go slow.
Okay.
So what I would like to do first is just to look at your port. Okay? So this looks marvelous. You have a little incision here which is healing very nicely. What I want you to watch for is any redness, swelling, drainage, any pain, or if you start feeling any swelling or pain in your arm or shoulder. These are very important things that you would want to tell your doctor immediately. Okay? Yours looks fine. If you look really closely, you can see some bumps.
Yeah.
I'm going to outline it with my fingers. It's shaped in a circle, and you got little bumps here that tell us what kind of a metaport it is.
Okay.
When we access, we go right in the middle of the bumps. The port is a round circular disc underneath your skin. It is attached to a tube that goes into a major vein that goes right to your heart. That makes it very safe for us to give chemotherapy, to draw blood. We can do anything through this port, very safe. If you had to have chemotherapy in your arms, it would burn up the veins in your arms, and we don't want to do that. So this is a very safe way to do.
Okay.
To access your metaport, of course, I have to go through that skin layer. To do that, I have a needle that will go through the skin straight to the metaport. There's no digging around. We just go right in and you're all done. Needles hurt. Some people like to numb the skin. We have two ways to do that. Either a little ice baggie and we put it on and you just hold it for 5 minutes, or we have a spray. It's a lidocaine spray that we just spray, and it numbs the skin and gets very cold. The first time we want it to be a wonderful experience, so we always offer an ice bag. Most people say, yeah, let me try it. After the first time you'll say, it wasn't that bad, just go ahead and do the needle. It's your choice. We can do it either way. Whenever anybody touches your metaport, they should use a sterile package. If anyone tries to access your port and doesn't have sterile gloves, I want you to stop them and say, excuse me, could you get some sterile gloves, because I want this to have sterile. So in the package we have all kinds of different things. This is a sterile procedure. So here's my sterile field, my sterile saline, and you don't have to remember any of this. I just want you to know. There is a mask in the package. This is not part of the procedure. I wear it because it's in there and I'm just going to throw it away. But if somebody tries to access your port and doesn't have a mask on, it's okay. It's not wrong. So I'll put my sterile gloves on.
Oh, okay. All right.
Okay, now in this package I have everything I need. This is my sterile field. I'm going to hook this over your clothing. Do not touch this or I'll fuss at you. And this will give me a clean place to work. And you can hold your shirt underneath. The best clothing to wear is something exactly like you have on, something that buttons down the front or has a V or a very loose neck. If you forget and you wear a turtleneck shirt, we will draw the curtain, we will lift the shirt, access the port, and then put the shirt back down so it's not a crisis. Okay, so we have our nice sterile field. Next, I take my cleaning medicine. This is chlorhexidine. It is not alcohol. And all I do is I'm going to rub back and forth and up and down for 30 seconds. I hold my watch right here so I can watch 30 seconds. It's a little rough. Your Metaport may be a little bit sore because you just had it put in. Just tell me if it's too rough, but this scrubbing is cleaning to make sure that the germs are gone. After 1 minute, I will do the access, and this is the part that everybody's worried about, but we're really good at this. You're doing very well. Now this is the needle. The needle has a bend in it. To have your Metaport access it has to have a specialized needle, and it has to have a special a person that's specially trained. I'm putting some sterile saline into the tubing. You see a little squirt. Now it's very important that we do not get germs onto the Metaport after I've cleaned it. So you're going to keep your head sideways so you're breathing sideways. Now before I start the accessing, I'm going to count to 3. I'll do 1, 2, and on 3 I'll put the needle in and you will take a deep breath. Okay? 1, 2, deep breath, and you're all done. That's all there is to it. That's the worst part of today. How was it?
Not bad at all.
All right, you're a champ. So now I'm going to flush. I check for placement. I have to make sure I have blood. It is perfect. Now I'm going to clean with alcohol and we will hook you up to your infusion. Everything you get today will go through your Metaport. You can get up, walk with that, just push the pump ahead of you. Now when you have a Metaport in, you want to remember a couple things. Everything's under the skin, so you don't have to worry about infection or it falling out. It can move. If you feel like there's a swelling or a pain, you want to make sure you tell your doctor. You want to take a shower as this incision is healing. Let the nice warm sudsy water go over the incision. Don't pick at the scab, don't pull it off. Just let the warm sudsy water go over, pat dry, and it'll heal in about a couple weeks. If it turns red, swollen, or drainage, you need to let the doctor know there might be a germ. When you have a Metaport in, you can do anything you normally would do. Just live your life, exercise, do whatever you're normally going to do. If you want to lift weights, ask your doctor first. Bicycling, swimming, all that's fine. Every chemotherapy is a little bit different. The lengths vary. Some people come and it's a 5-second infusion, literally. We count 5 seconds. Other people, it takes 8 hours. It's just the different medications. We will not do anything to you or with you without your full understanding and answering all your questions. We want you comfortable. We love being part of your family now, and we will take care of you like we would one of our own family.